Okay, so I think I'll start off with my introduction, and if a few people come in, that's okay. So, good afternoon, everyone, and welcome to you all. My name is Collier Curran. I'm the Association Manager for MACC. I would like to thank all of you for logging on today and for continuing to support MACC during these difficult times. We have been working really hard behind the scenes to ensure that 2021 will be an active year for MACC. Both in the time of these virtual events and social distancing, as well as when, fingers crossed, things begin to open up. I can't think of a more timely webinar to kick off 2021 than discussing ways to keep your workplace compliant with the constantly evolving COVID restrictions. Our presenter, Barbara DeMatteo, has prepared a thorough and informative presentation covering topics like whether employers can require vaccines, voluntary FFCRA benefits, and returning to work after foreign or domestic travel. Barbara has over 35 years of human resources experience supporting businesses across many industries, so we're in great hands tonight. Before I hand it over to Barbara, I do want to remind you that you can type questions into the chat feature, and we will be taking questions at the end of the presentation, but please feel free to submit the questions as you think of them, just so we have a nice list of questions to get to at the end. I would also like to remind everyone that MACC is having another webinar next week on Wednesday, February 10th, and that will be covering the second round of PPP and everything you would need to know about that. So if you are interested in registering for that, you can visit our website, which is www.maccny.org. So without further ado, please welcome Barbara DeMatteo, Director of HR Consulting at Portnoy Messenger Pearl and Associates.
Thank you, Collier, and welcome everybody. And it's good to see, but kind of not see everybody. So I welcome you all. What a fabulous group. And the only thing that I can start off, what I'd like to start off with, is I continue to wish you and your families and all of your employees well and safety. So let's get right into the material because there's a lot to cover. In this presentation, I'm going to be referring to a number of documents. And I have promised Collier that I'm going to be sending an email to her with all of the links that I've talked about, as well as any documents that I may not have easy links to. And I'll send that to her and ask her to forward that on to all of you. So this way you can make sure you have the information that I talked about today, and that is all current, that's coming from the New York State Department of Health. So let's get right into our material. And where I'd like to start off with is statistics. And, you know, we read them every day. Sometimes we get a little blindsided by them, but these are the stats as of today. 451,000 people have died in the United States. 43,000 of them have died in New York. That's just hard. That's just unbelievable. And let's hope that the vaccines are going to change those numbers going forward. So what we want to talk about is this agenda, which is the agenda that we sent out inviting you to today's session. Can we require vaccinations? How does the voluntary FFCRA apply? What are the quarantine periods? And then how do we return to work? So let's get right into the first question. Can employers require vaccinations? Well, the short answer is yes. And the longer answer is, well. So what we first want to talk about is what you can do and what we need to think about. So the first is to determine if you are an essential business, which I know all of you are because we're in construction. So being an essential business, knowing that, we're now going to be listening out for the governor's announcements as to how and when he's going to be adding different groups to the list of people who can get vaccinated. We heard this week that the new group that's being that is added to the group are taxi drivers, are restaurant workers, and I think that there was another group. So not quite yet the construction business, but it behooves us to hear what's next on the list because it's going to be important for you to start to plan how business is going to run when employees start to get appointments. I've had my own personal appointment trying to get an appointment for my 91-year-old mother. And trust me, when you see the list, you grab the first one that you can. So not everybody can do it after work or before work. So it's something to think about, especially when the construction business is added to those lines and you get added to the food chain to be added to the vaccination list. Now, if you decide to mandate vaccinations, there are a lot of requirements that you're going to need to abide by in order to protect the information that you obtain from the employee. So you never run afoul of having medical information that can be used to take an adverse action against an employee. So can you mandate it? Yes, you can. We need to think about what's going to happen if you mandate it and you have a few employees who are not going to take it. They're going to refuse it for a general reason. And we'll talk about reasonable accommodations in a little bit, but I just don't feel like it. I just don't believe in it. Will I be fired? Will you let me go? Will you let me continue to work? And then you have to treat me consistently, because if I'm not going to take it and I am your not so great employee, but Mary decides not to take the vaccine and choose your fabulous employee, well, I'm going to claim discrimination. All right, we may be females, but I'm definitely older than her, and I got a backache, and give me something else, and I'll find some reason to claim that you're discriminating against me. So we need to really think consciously if we want to mandate the vaccinations. If you choose to encourage vaccinations, which is what I am seeing the majority of employers doing, just consider how you're going to approach the workforce. And communication that's forthcoming to me is the best solution to everything. And many of you have heard me speak that I'm always a proponent of proactive verbal in-person communication where we can, and then support it with materials beyond our verbal message. So if and when we are going to encourage vaccinations, think about how we're going to do it. If we're going to provide an incentive, for example, what kind of an incentive are we going to provide? And make sure that that is administered consistently to everybody. And then you have to think about what kind of an incentive, and does it create an incentive, or could it be perceived as a coercion to require the employee to be pushed into taking the vaccine? So let me explain that. So if you give me a financial incentive, say you give me $100 to go and take the test. You give me the rest of the day off to go and take the test. You give me a coffee mug with your company name on it. You give me a pen with your company name on it. A gift card that's a very modest value. Say it's an Amazon gift card of, $20, something like that. Okay, those are reasonable. That's a nice kind of recognition and an incentive. But where an employer is going to incentivize taking the vaccine with, say, an annual gym membership or airline tickets, even though we can't really travel anywhere, those are really not appropriate, and that could be considered as a coercion behavior to really mandate the employee to go and get the vaccine. So let's think about it. If and when you decide that you are going to mandate it, I strongly suggest you consult with either somebody like ourselves at PMP on the HR consulting side, and or an employment attorney, because we really need to lay out what are going to be the rules and the steps you're going to need to follow in order to make sure you are keeping the information confidential about the actual vaccination and any information that an employee is going to give you. The CDC has come up with a pretty darn good communication program, and I'm going to send you this link. And in this communication program, it includes posters and flyers and language that you can put into emails and memos and so forth. So I looked through every single piece of it, and I strongly suggest that if you're considering mandating it or even encouraging it, you take a look at this communication program and use some of these things as your tools to communicate with employees. Okay, let's talk about the next piece, and we're talking about potential legal considerations. So in addition to if you're mandating it and maintaining all of our information, we need to think about what are the potential legal issues that can actually come into play. And, with this, COVID is new to everybody, and nobody's been here before. So as you've seen and gotten frustrated as we have with the changes in the laws, the changes in the regulations, the changes in the guidelines since March of 2020, these changes are happening because it's new. I will say that there is already a large list of lawsuits that employees have made against companies where employees claim that they got COVID from the workplace because the employer did not provide the right protections. They didn't provide the right notice that somebody either had COVID and they were exposed, or there was an exposure to somebody in the workplace. And those lawsuits have just started. So no one knows how far that's going to go. We anticipate it's going to be quite widespread. We also need to think about people who are suing companies because their family members have died because they are claiming they got COVID in the workplace and no one did anything about it. One of the first lawsuits actually came out in April of last year where an employee working for Walmart died. And his family claimed that Walmart knew that somebody had it, didn't do anything to protect the employee, and he subsequently passed away. So these are the types of things that I know financially we never want coming out of our pockets. And secondarily, I don't think that we ever want something like that to be listed as advertising for us. We don't want that in the newspapers. So we work way too hard for our reputations. We've talked about this so many times in our conversations. You work way so hard for your reputation. Let's make sure that we're being proactive with employees. We also need to think about that if and when an employee gets sick and unfortunately may pass away or have additional illness issues, it's going to affect workers' comp. And then your workers' comp numbers are going to be going up. So there's lots of issues from a potential legal consideration that we need to consider if we are mandating it. And secondarily, even if we are just encouraging people to get vaccines, but even more so, how are we continuing to protect our workplace and how are we continuing to encourage people to wear their masks, to wash their hands, and keep 6 feet away in social distancing? Now, when we also think about any actions that are taken around employees with respect to COVID, whether they took the leave, whether they're not going to get the vaccine that's mandated, whether we encouraged it and they are poo-pooing it, or whether they're saying negative things around it, we have to make sure that we are never retaliating against that individual, because we all know how easy it is for an individual to make a claim of retaliation. And because COVID is such a highlight in today's conversation around the country and the workplace, it's very easy for people to say, oh, suddenly I was fired or my hours were reduced. And I believe it all had to do with this behavior or this situation that happened with COVID. And then we're going to have to defend that. So we need to think about that. So what do we really do? My suggestion is we need to think about best practices. And again, whether you're requiring or not requiring the vaccine to happen, identify a COVID coordinator. And if you're mandating the vaccine, have a vaccine coordinator. Have one person in your organization to whom everything funnels through. Because when there's a couple of people whose hands are in the pot, we may not always consistently make sure that issues are addressed in the same manner, in a consistent manner. And having one person as that coordinator, as that communicator, can be a really powerful thing, because then we can very easily in the future say, here was the person who we had designated, here were the behaviors that we did, here's a documentation of all the communication that we had, whether it was a mandated or not vaccine, or whether it was just communication with people about COVID issues in the workplace or how to keep safe. Here's everything that we did, because we don't know what's the litigation that's going to come up in the future. And goodness, I just hope it's not going to be anybody, and I hope we'll never have one. But we all kind of know what we're betting on, right? So if you're going to have it, have a vaccine coordinator. Make sure the practices are consistent. Make sure that when we're making decisions that we're documenting what we've done. Develop a written plan and say we either are having a mandated vaccine and here are the rules, here's the incentive, or here's the recognition, here's the award, here's how we're handling people who went to go and get their vaccine at 9 in the morning as compared to getting it done at 3 in the afternoon on a Saturday. How are we handling pay? How are we handling all the things that come into play? If you're going to incentivize the vaccine, develop a written plan too. Date it and talk about the fact that you're just going to incentivize it. And here's the maximum of the incentives. And here's who's going to make the determination. And here's how it's all going to work. And then educate your employees. Use some of that CDC information, which was powerful. Add your own twist to it, which is based upon your company culture. And talk about whether or not you will or will not require vaccinations and how it's going to work. Maybe you'll talk about if you're able to make arrangements to have vaccines brought into the workplace when and if we have enough of them in New York State. Okay. But I have heard about some organizations who were able to do that, or where there's a large enough of a population where they were able to make arrangements with a local vaccine center to bring all of their employees kind of all at once or on a schedule. So best practices, I'm repeating what I had said before: communicate, communicate, communicate. And when I talk about what we've communicated, I talk about having a quote COVID book. And whether that COVID book is something in hard copy or whether it's electronic, it should be chronological with all of your communication. And that's why this vaccine coordinator, this vaccine person, can really take a look and say, oh, I really haven't sent anything out in a couple of weeks. Let me make sure that I'm doing that. Or what do I need to repost? Or boy, that poster on the kitchen wall is really getting a little dog-eared. Let me replace it with something else. Or let me just replace that. And log everything that you're doing. That COVID book is going to go a long way in helping you make your defense. Now, let's say that you decide that you are going to mandate vaccines. If you require it, then you're going to need to be aware of the requirement to make an accommodation for employees based on medical reasons and religious beliefs. So if an employee asks for an accommodation and says, I'm not going to take the vaccine because either of a medical reason or a religious belief, you are required and you need to engage in what we call an interactive and cooperative dialogue. And that's in quotes, to determine whether or not your company can provide a reasonable accommodation, provided it does not create an undue hardship for the company and does not pose a direct threat to the health or safety of others in the workplace or to the employee. Now, many of you have heard this terminology, right? You can't discriminate, and under the Americans with Disabilities Act, we have to accommodate employees. In New York City, we have to accommodate pregnant employees. We have to accommodate religious accommodations. Well, COVID's another piece to that. And this interactive cooperative dialogue is required by New York State law. And whether we're in New York State or whether we're not, I feel and we promote that this is a really good practice to follow, because it means that it's a conversation. It's a discussion. If I'm asking for an accommodation, this is tough for me because I'm asking for an exception to be made for me. So just having a memo sent out with a policy really does nothing to employee engagement. And then I feel as if nobody cares. So talk with me, document the discussion. We on the back end are going to have a conversation as owners and managers, and then we're going to communicate verbally with the employee and follow up with a final written decision to the employee. Be clear that employees can always ask for accommodations for any reason, COVID or not, without any fear of retaliation, and it's up to each and every one of us to make sure that that doesn't happen. So if you're going to be going down this conversation and down this route of accommodations, as I suggested before, my strong suggestion, get somebody like us at P&P as an HR consultant or an employment attorney to help you through this, because it's very easy for people to claim that they were not provided with the opportunity for an accommodation, that the interactive dialogue didn't happen, and they feel as if they're being retaliated against. So really what we've done is that we've kind of come full circle on the question of whether or not I can mandate vaccines. So whether or not you mandate or incentivize it, the decision is yours. Be consistent in your actions and the behaviors with every single employee. Document, document, document. Because when push comes to shove, we're not going to remember a year down the road exactly what we said to the employee, and the employee is going to have much better notes than we do. Ensure no retaliation takes place. Have a conversation and communicate versus just sending out emails and memos. It just leads to that better employee engagement and connection with your firm. I know that you're taking this seriously. These numbers are not lying. Always support your verbal and written communications with your actions. Remember, actions speak louder than words. Sadly, I have a client who I'm working with who, yeah, they send out the communications as it's required, but the owners don't wear the masks. They have meetings and they don't have any plexiglass in between them. And that's very uncomfortable for employees. And it's very uncomfortable for everyone. And it sends a mixed message. And the message that's being sent is that ownership really doesn't care. And it's important to understand and to define what you want to say. It is your message, and then support that with your words, with your actions. Even though an employee gets a vaccine, whether it's mandated or voluntary, the rules are going to remain. Wear a mask, wash your hands, maintain social distancing. Even though an employee has had a case of COVID, the rules still apply. Wear a mask, wash your hands, maintain social distancing. So even if we require that vaccine or we incentivize it and the employee gets it, it doesn't allow them to now walk out into the public or into our workplace without a mask and not protect everyone else from them. So what we've done in this section is we've talked about, can employers require vaccinations? And Collier, what I'd like to do is see if I can come in here and see if there are any questions. I don't see any. Are you seeing something that I may not be?
I don't see any questions either. If anyone has any, feel free to type them in right now, but it looks like we're good on questions for now.
Terrific. All right. Thank you, everyone. So now let's start talking about the voluntary FFCRA benefit. So first off, we want to talk about how this works, and I want to start with a little history because it's important to remember some of the 3 dates that actually impact us as employers as it relates to COVID. So on March 18th of 2020, God, it sounds like forever ago, right? It's almost a year. New York State enacted legislation authorizing sick leave for employees who are subject to a mandatory or precautionary order of quarantine or isolation due to COVID. New York State did this because the federal FFCRA benefits hadn't come into play yet. And New York State said, wait a second, I got people who are out of work. We need to provide some benefits for them. So they implemented this legislation. We're going to go over it in detail in just a bit because it still applies. It never had a sunset date on it. So now that FFCRA benefits are going into the full year, employees are going to be eligible to apply for these New York State benefits. The second date that's important, on April 1st, FFCRA, which includes the Emergency Paid Sick Leave Act and the Emergency Family and Medical Leave Expansion Act, came into play. And these provisions were effective from April 1st of 2020 to December 31st of 2020. We all know that the mandatory requirement to provide these benefits ended on December 31st. The next date we want to talk about is we want to talk about January 1st of 2021 through March 31st of 2021. And this is the voluntary extension of this benefit, which was the April 1st benefit. So what it does is that it now is voluntary for employers. You don't have to give it. But I'm going to talk about why not. You're going to get tax credits back on it, so you're not losing anything. You're continuing to help employees get through COVID issues, which are very clearly defined. And there's no downside to doing this. Now, right now, we know that the voluntary extension of this and the tax credits are going to expire on March 31st. No one knows if that's going to be extended. No one knows right now. So let's just go with the assumption that that is the end date, okay? And I see that Diana has raised her hand. So let's see how we can get Diana to ask a question. Diana. This is only for employers with less than 500 employees. I'm going to go into that in just a minute. We're going to talk about the thresholds. So very good question. We're going to talk specifically about those thresholds in just a minute. So thank you for bringing that up. So now that we've talked about the benefits and those 3 dates, let's just talk first about the type of leave that an employee can take off under the FFCRA. And there are 6 of them here. I'm really going to cover 5. Because number 6 is, we believe, was kind of a placeholder because I don't think that they were really sure what they wanted to include in there, but that really nothing's been applied to that. So as we've got these 5 reasons, I want to break them into 2. Let's go over the first 3. In these first 3 reasons, where an individual is subject to a federal, state, or local quarantine or isolation order, has been advised by a healthcare provider to quarantine, or have COVID symptoms and is seeking a medical diagnosis, the employee is eligible for paid sick leave under FFCRA for up to 2 weeks, which is 80 hours, at the employee's regular rate of pay not to exceed $511 a day and $5,110 in the aggregate. So this benefit caps at $511 a day, and this is not intermittent leave, because if I'm out because I have COVID, I got to be out for my 2 weeks. There's no question about that. Now, the voluntary FFCRA extension does not provide additional benefits to employees because the FFCRA is a one-time benefit. So if I had COVID in December of 2020, I am not eligible in 2021 to an additional 10 days of $511 a day because I'm under this local quarantine or isolation order. I could be eligible under the New York State benefits. So that's why, if I don't say it once, I'm going to say it a number of times. When an employee says, I believe that I've had close contact or I believe that I have it, don't say get a test. Suggest and direct the employee, go to a healthcare provider, and I need a note from the healthcare provider about what the direction is. They will tell you whether or not to get a test, and that healthcare provider's note is going to tell us as the employer when that employee can return to work. So please, if you've been using the language, go get a test, that's not the language, because getting a test is not going to give me the healthcare provider's information. We want that healthcare provider. If they go to their own doctor, they go to a city MD, whomever it may be, that's great. They're the ones who are going to tell us what to do. Okay, now let's talk about the second section and items number 4 and 5. Okay, so I'm caring for somebody, or my child is at home because the school or my place of care is closed, or child care provider is unavailable. This is not because I decided to keep my kids home from school. And this is all related to COVID-19. So these individuals are entitled to paid sick leave for up to 2 weeks for 80 hours at 2/3 the employee's regular rate of pay to cap at $200 a day, and then the expanded FMLA benefits and another 10 weeks. So for a total of 12 weeks, the employee is eligible for COVID pay for these 2 reasons, for 2/3 pay to a cap of $200 a day, not to exceed 12 weeks. Now, what I want us to remember, which is very often confusing, is that we're talking about a 12-week period of time, but it really is hours. So if I take 40 hours a week times 12 weeks, it comes out to 480 hours. Because the employee is eligible to take this time intermittently throughout the day or throughout the course of the week, it can technically go beyond that 12-week period of time. So if I am at home on Monday, Tuesday, and Wednesday because my children are home from school, well, Thursday and Friday I go to work and I am getting paid for my work that I'm doing, right? On Monday, Tuesday, and Wednesday, maybe I don't need the whole day off and I can actually work for 4 hours of the day. We have to make sure that the employee, when they are documenting the hours that they are working, are documenting how many hours and what was the time that they worked. So that's coming out of your payroll and you're paying them, which you always have. And then the remainder of that time they're going to indicate is the FFCRA benefits. As many of you have had these situations, you're still paying that out of your payroll, but it's designated and coded on your payroll, so this way you can get that tax credit. I hope that that's clear. So this is just a summary of these 3 dates, of which all of them are really important to remember. And I'm going to say it again. Just because we started out with benefits in April 1st and it expired on December 31st as the requirement from employers, just because it was extended doesn't mean I get a double and new set of benefits that I can use going forward. Okay? All right. So now what I'd like to talk about is what happens when an employee has used up all of their FFCRA benefits. So if I have used up all of my FFCRA benefits, I can apply for New York State benefits when my FFCRA benefits are exhausted. And here again, remember, is that March 18th rule, because that has not had a sunset date on this. So right now, this is going on unlimited. Now, here's a brief chart, and Diana, hopefully this is going to answer your question, which talks about the New York State benefits. Now, it's based upon these 5 columns here, because the 5 columns clearly define the size of the employer. So pay attention to the column that applies to your business. If you are 10 or fewer employees on January 1st of last year with a net income of 1 million or less, these rules apply. If you're 10 or fewer employees with a net income of 1 million or more, this applies. If you're 11 to 99 employees on January 1st of last year, this applies. 100 or more employees on January 1st of last year, this applies. And employers with 500 employees and more happens here. So let's kind of take a look through this and see how we can apply this. Suddenly I just got something blocking my screen here. So let's say I'm going to assume that a lot of us are in this 11 to 99. Let's talk about the difference between here and here. First off, under New York State, in order to apply for these benefits, which are New York paid family leave and New York State disability, that's the combination of the benefits that employees apply for, there has to be a mandatory or precautionary order of quarantine or isolation issued by these agencies, okay? So if I am here, first off, I'm always eligible for unpaid sick leave. In the beginning, if I am out for my COVID reason, because of the quarantine, the company pays 5 work days for me. This is beyond my accrued or given New York State paid sick leave. It's beyond my PTO time. This is an additional 5 days that comes out of a different bucket and out of your pocket. You pay to the employee. You'll never get this back. And it's not subject to tax credits. Sorry. Then the individual is eligible for New York PFL and disability, which can equal 100% of salary if the earnings are less than $150,000 a year. And obviously there's job protected leave and no retaliation. If we're at 100 or more employees, then it's 14 business days, which comes down to 10 work days. And then the individuals are not eligible for the New York PFL and disability. And the same thing applies here for 500 or more employees. So yeah, the thresholds make a difference as it relates to what's your size of employer, how many employees do you have, and whether an individual is eligible for these benefits. And if someone is going to be applying for the New York paid family leave and disability, the employee is going to start that process. Now, what I now want to go to is to talk a little bit about the New York benefits. And New York State, I'm going to send this to you. New York State provided guidance on the use of this COVID leave. And there are 2 pages of pretty straightforward language. And what I want to do is I want to explain how this works. So I want to talk about first, if I am fewer than 100 employees. So those of you who are fewer than 100 employees, this is the part to pay attention to. If an employee is eligible to be out and get the New York State benefits, they're going to be eligible for the 5 days pay that I said before, right? However, they may be eligible for getting paid for that 3 times. So not only would you be required to pay it once out of your own pocket, and you can't take it out of the employee, but potentially 2 more times. Let me go over the reasons. I can get it if I have a positive COVID test twice and if I'm exposed once. Okay. The other situation can happen is that I could have a positive COVID test twice and be exposed once. If I am more than 100 employees, the same rule applies. However, the number of sick days increases to 10. Remember we talked before, it's 14 business days and it's 10 work days. So if an individual is out having a positive test twice, and exposure once, they can get up to pay of that amount of money 3 times. So when you see this, you're going to see this explanation here in this document, which again is fairly straightforward. And I think the most important piece is this last paragraph. In no event shall an employee qualify for sick leave for more than 3 orders of quarantine or isolation. The second and third orders have to be based on a positive COVID test in accordance with the prior 2 paragraphs. So this is not a big gimme to anybody, to any employee. And yes, you're paying money out of your pocket that you will not get back, but you're capped out. So I hope that's clear, but it's important to understand how that actually works. Now, if an employee is going to be filing for the New York State benefit, these are, and I'll send this to you, I'm going to send you the link to this website page, as well as these 2 pages, because this is the documentation that employees will need to file in order to see if they can get the benefit. Now, this is the paperwork here is similar to the regular New York paid family leave. A lot of it very much looks the same, but it was adjusted because of COVID for not only child, but also for yourself. So the same process is going to apply. The employee is going to ask you, you're going to give them the paperwork, they're going to fill out the portion of it, they're going to give it to you. You've got a few days in order to return it to the employee. They then return it to the carrier, and the carrier has to respond within 18 days. So that process has not changed. But the forms are a little bit different from regular New York paid family leave, and this is the process that they will follow. Oh my goodness, that was a lot. Phew. So now let's see what happens. What are the required quarantine periods for contact and close contact with a COVID infected person? Okay, so I'm going to be sending you links to these documents, and this is what I am referring to now. One is coming from the CDC, and these other 2 pieces are coming from New York State. So first, the first thing that we have to understand is that there is the same rules that come from the CDC and New York State if I have tested positive. If I tested positive, I can return to work 10 days after 10 days of isolation from the onset of the symptoms, or 10 days of isolation after the first positive test, if I remain asymptomatic. So it's not up to us to be doctors and figure out when somebody was asymptomatic and when they had their symptoms and when they got tested and all of that. That's why we are always suggesting direct the employee to go to a healthcare provider, not just to go to get a test, because you want the note back from the healthcare provider that says when a person can come back. You're not going to be requiring an employee to get another test after the 10 days of isolation. First off, it's not required. Once the 10 days is gone, unless an employee had some additional issues, which they're going to talk about with their healthcare provider, they're allowed to come back to work without another COVID test. Now, remember, on the New York State rules, I said that you can only get 3 times of that sick day hit, and it has to be because of a positive COVID test. If I'm tested positive for COVID today, I'm still going to test positive for COVID 3 months from now, even though I don't have it anymore and I can return to work. So you don't want to incentivize the employee to say, hey, give me another positive COVID test and I'm going to continue to give you more money. So the bottom line here is if I'm tested positive, they can come back to work after 10 days. Nice and simple. Now let's talk about close contact. Close contact, we've heard the New York and the CDC guidelines, and our suggestion is that we work off of the CDC guidelines, which is kind of straightforward and simple. I've been in close contact with somebody who has COVID for 15 minutes or more, and I've been within 6 feet of them. Done. Otherwise, in New York, it's starting 48 hours before the illness onset until the time the person was isolated. How am I going to figure that out? Make it simple. 6 feet for 15 minutes or more. People know when they have been in close contact, and direct them to go to the healthcare provider, tell the healthcare provider what's going on, and the healthcare provider is going to require a test. You're going to get a note back from the healthcare provider telling you when the employee can come back to work, and you're going to get a copy of that positive or negative test, because they were in close contact. Even if an employee gets a negative test after close contact, they still have to be quarantined. And the simplest part of a quarantine comes from this document here, which is dated December 26th from the New York State Department of Health. And it says, consistent with recent CDC guidance, quarantine for individuals exposed to COVID can end after 10 days without a testing requirement, and if no symptoms have been reported during the quarantine period. And then there are some rules underneath that. They have to continue to do daily symptom monitoring through day 14. They must be counseled to strictly adhere to non-pharmaceutical interventions, wash their hands, masks through day 14, and be advised that if any symptoms develop, they have to immediately self-isolate and contact the local public health authority or the healthcare provider to report this and determine if they should get testing. So again, even the New York State Department of Health is saying, go to your healthcare provider. Just don't get a test. Go to your healthcare provider. And I hope that that's a nice, clear message that I'm making today. All right, so now let's talk about what happens when I am going to return to work after domestic and international travel. And I think what we saw in the Thanksgiving and holiday and New Year's season is that a lot of people started traveling. And New York saw a definite spike in COVID issues and positive COVID tests after that. So, domestic and international travel, people are starting to travel, whether they're deciding to go on vacation, whether countries are opening up or not, they are. And so here are what the rules are. Now, no, this is an eye test, so I'm not going to ask you to look at this eye test. And I will get this document to you because this is our guidance to our clients about what to do for essential businesses. Let me narrow it down and let's look at this piece by piece, make it a little easier to read. First off, you are an essential business because you are in construction. Your employees are considered essential because they're working for you. These rules for domestic and international travel, these New York rules, do not apply to travel from states that border New York State, so not the contiguous states. If a person travels outside of New York State allows people, because you're essential, allows your employees to return to work immediately, and New York State requires a COVID test on day 4. And then if the test is positive, the mandatory order of isolation is for 10 days, okay, from that date. So that's the first rule that's out there. And that's what happens from New York State. Now, if I got somebody who's coming from out of New York State, especially to a state that I know has a high COVID test, has high COVID numbers, or they're coming from a country which is on that high list, which is 99% of the world, I'm not so sure me as one of my coworkers are going to be comfortable with me coming right back to work and just getting a test on the 4th day. So you have an or. You can require quarantine for 3 days after return to New York State. And then New York State still requires the COVID test on day 4. So you can at least require a quarantine for 3 days. So you have the minimum, you can always implement more, but you have to do it consistently across everybody. Or you can require a quarantine for 14 days from the date of return to New York State, and then the New York State requirement to have a test on day 4 comes into play. Now, I'll share that our office has decided to quarantine for 14 days. Now, we're non-essential, so our rules are a little bit different, which are only 10 days, but we are abiding by 14 days. That's important to us to make sure that we're being kept safe. That's a decision that each of you is going to make. Just as an FYI, because it's just completing the information, I know it doesn't apply to you, there are also rules that come into play for teachers, school teachers, and childcare workers who travel outside of New York State, okay? So regardless of who it is and what's going on, New York State is requiring a COVID test on day 4, all right? Now, let's talk a little bit about a few other rules. Employees who can work remotely while they're under this quarantine when they have returned from travel, if they can work remotely, they're to be paid for the time that they worked. So please make sure, especially if they are hourly employees, that you're getting details about the hours that they are working, and just don't let them give you a timesheet saying 9 to 5, 9 to 5, 9 to 5, 9 to 5. That's a schedule, that's not a timesheet. The timesheet is something like, remember the old days when I used to come in and clock in. It actually took me at 8:59 or 9:02, whatever it may be. That's what you want. Pay them for the time worked because it's leading to wage and hour claims Employees are claiming that they're not getting paid for the time that they're working. Next, employees who are under the state quarantine and cannot work remotely are only eligible for the FFCRA benefits, not the New York State benefits. And then lastly, employees who are under the company's quarantine, let's say me, where our quarantine is 14 days, and let's say I cannot work remotely because my job doesn't allow me to, it's considered unpaid time, and I can then use accrued and unused PTO or vacation or sick time and whatever you have in your organization. So that's what this eye test says. And again, I'll pass this on to you. So this way you have it in front of you. You can use this as part of your communication to your employees. Just pick one of these and communicate that to your staff. So what we've done is we've kind of come full circle. Not kind of, we have come full circle. We've talked about all of the items on our agenda, and I'd like to ask, do you have any questions? And Collier, if we want to do it verbally or with raising hands, I'm going to leave that up to you.
Yeah, either method is fine. If you'd like to ask your question verbally, you can use the raise hand, or I believe most people are able to just talk. Otherwise, we have the Q&A feature that has been utilized earlier, so feel free to type in a question. But yeah, we will stick around for the next couple minutes to give people a chance to type or ask questions if they have them.
I'm hoping this has been helpful. It's always helpful to me as I was preparing for this to remind myself, because we do talk about this every day, and we are on top of all of the new rules. And it's important to make sure that all of you have the data and the information that you need in order to respond to and be proactive with your employees.
And as a quick reminder, if you did register, I have your email address, and so I will be sending the email with all of the resources that Barbara had mentioned. Oh, it looks like, do we have another?
Thank you,
Oh,
Diane.
it was just a thank you for a good presentation.
Thank you very much. All right, Collier, I'm going to sign off. If anybody's got any questions, please, you have my email address. You're welcome to email me directly. I wish you all a continued good week, a fabulous upcoming weekend, and most importantly, I wish you and your families good health and be well, everyone.
Great. Thank you, Barbara, and thank you everyone for attending. This was a great presentation, very informative. So I will be sending that email either tonight or tomorrow morning with all of those links and all of that information, so you all have it. As Barbara said, please feel free to reach out to her with any questions. You can also reach out to me and I can pass them along. But overall, thank you all for attending, and I hope you all stay safe and be well.